Okay, Chair, I can confirm that the live streaming has started. I'll pass over to yourself. Thank you.
Hello and welcome to this meeting of the Adult Scrutiny held on the 2nd of March 2021. Welcome everybody. Paul, could you do a roll call, please?
Of course, Chair. As we do, has become very familiar in meetings recently, I'll just go through a roll call of members. If you can just unmute your microphone, confirm your attendance at the meeting, and then mute your microphone once again, please. So Councillor Bell. No, I can't see Councillor Bell on the participants list either, so I'll come back maybe later. Councillor Crumby.
Present.
Thank you, Councillor. Councillor Mrs. Cully.
Hello, I am here today. Also, Councillor Bell does have another meeting, so I don't know what time that meeting finishes, whether he will be just late.
I'll keep an eye on the participants list to see if he comes back in.
If not, it's apologies from him. Thank you.
Okay, thank you. Councillor Curry.
Here, thank you.
Thank you. Councillor Holroyd.
I'm here.
Thank you, Councillor. Councillor Lang.
Hello, I'm present.
Thank you. Councillor Layton.
Present.
Thank you, Councillor. Councillor Michael Nicholson.
Present.
Thank you, Councillor. Councillor Preston. Now, again, I don't have Councillor Preston on the participants list. However, she did suggest that if she couldn't get away from work, I was to tender her apologies accordingly, so I will note those. Councillor Renton.
Present.
Thank you. And Councillor Andy Scott.
Yes, here.
Thank you, Councillor. Thank you, Chair.
Thank you. Item 4, declarations of interest. Are there any declarations of interest? Doesn't appear to be. Next item is to approve the minutes of the meeting held on the 5th of January 2021. Could we go through the minutes on page 1? Anything? Page 2? Anything? Page 3? Don't know how many pages there are. Any comments anywhere on the paper at all? No? Okay. If we can... Oh, Councillor Layton?
Sorry, I am trying to raise my hand, but the logo's changed, and for my very poor eyesight, I don't really know what I'm doing. It's really just as a newbie, sort of more a procedural concern, and it's on page 5. It's actually part of AD 22. And I do apologise if I've always got my head down because I write copious notes. So I just had concerns, and I'd like to sort of highlight them and just register my concern about this issue. As a new councillor, I did feel we were asked if we were happy, they were the words that Elizabeth used, about the MTFP recommendations, and it was a rather sort of almost like an afterthought. I think it was just the way the meeting had run on, and after sort of quite long discussions about things like COVID and the pressures on adult social care, and also things like anticipated extra funding from government relating to sort of COVID issues, the discussion had sort of expanded rather, and it sort of just became rather sort of woolly and vague. So at the end, when it sort of almost it went on to the next topic, and then Elizabeth sort of had to chime in and say, you know, is everybody happy? The vote sort of took on a very sort of rather woolly and vague, informal sort of manner. And when you look back and you think we voted on something that had really serious ramifications for the whole of the MTFP budget, for the whole of the council and for all the members and residents of Darlington. It just seemed a little bit sort of hazy to me, and for a new member it was sort of concerning, because I sort of take notes and I was thinking I wasn't quite sure what was going on, and I just wondered if you know, from a procedural point of view, my concerns about that particular issue could be noted for the record, please. Thank you very much.
Councillor Cully.
Thank you, Chair. With regard to that, we were given the papers some considerable time for the MTFP before this meeting. Elizabeth did make it clear in the meeting what we were voting for, and it's basically down to the chair to make sure that we know what we're voting for. But as I say, we have had the papers. We were given the papers. The papers gave the recommendation, and Elizabeth said exactly what we were voting for. So if you didn't know what you were voting for, then maybe you shouldn't have been voting. Thank you.
Chair, can I just come back on that? I do diligently read all my papers, and it's normally, you know, it's quite clear. It was just in this particular case, it overlapped because we'd already moved on to the next thing. And just for Councillor Mrs. Cully's reference, I am I am a really diligent councillor. I do read all my papers and I make notes, and you know, so everything I looked at, I even looked back at the video, and I do watch the videos and make notes from the videos as well. It's not a political thing. It was just the wording, and just to have a vote on something so crucial, and just to be asked if you're happy with something just a little bit vague and fuzzy. That's my concern, and I just wanted it noted. It's not a criticism of anyone or anything in particular. It's just my observation, and I didn't want it just to pass without being able to exercise my right to note my concern and have it put on record. That's all this is about. Thank you very much.
Yes, Paul.
Yes, Chair, just to say that I'm aware of the concerns that have been raised in other meetings as well, and I'm happy to take Councillor Layton's comments back to the Democratic Manager if she'd like me to do that.
No problem. And if the Director Manager is happy just to have it noted on the minutes for this meeting that this issue was raised, can we do so? Okay, are we happy enough with that? Right, we now move on to the COVID response verbal update.
Would you like me to start, Chair?
Yes, that'd be lovely, thank you.
Morning, everyone. I hope you're all keeping well out there. I was proposing to just do a very quick overview of some of the key points that are occurring across the care sector at the moment, and then bring in Hayley Robertshaw, who's one of the care home managers working in Darlington. So thanks for joining us, Hayley. And I'll bring you in later to introduce yourself if that's okay, and I'll open the floor at that point. So in summary, I can report today a sort of an improving picture across the care sector. The LGA data set is actually showing confirmed cases in Darlington are dropping from 61.8 per 100,000 on the 25th of January down to 6.6 per 100,000 currently on as of the 27th of February. And that's reflecting across the care settings as well. So from our twice weekly ring-arounds to providers, we can report no deaths attributable to COVID over the last 2 weeks. And the numbers of staff and residents or service users who are testing positive is also decreasing. So from the 28th of September last year, the cumulative number of staff in older persons' homes who've tested positive is 271. and the number of residents who've tested positive in those settings is 284. And within domiciliary care and extra care, the number of staff who've tested positive is 73, and the number of service users is 33. But week by week, we can see those figures declining as they are across the population itself. We've currently got 6 homes that are experiencing outbreaks, but they're being really carefully managed with support from our colleagues in public health and the infection control team. And in terms of vaccinations, you know, it's been a really Herculean effort, but I can report that as of the 15th of February deadline, across the entire provider sector, that 95% of staff have been given their first dose of vaccine. And in the care home settings and the domiciliary settings, that figure is 99%. It must be noted, though, that that's not including those people who haven't engaged or who are poorly with COVID at the minute and will get the vaccine at a later date. In terms of sort of residents of older persons care homes, 94% of all residents have received their first vaccination. So there's still some staff, a small number of staff relatively, who are not engaging in the vaccination programme, and we continue to work with our primary care colleagues and public health colleagues to address those issues, and working with provider managers as well to continue to encourage staff. And it is a very fluctuating picture because people change their minds pretty much on a daily basis as to whether they are going to engage and get vaccinated. But it's one thing that we are watching very carefully and continue to monitor. In terms of care home visiting, visiting has been occurring in some of our homes throughout this period because they've got safety measures in place and it's safe for family members to do so. But as everyone knows, as of Monday, the regulations are changing, and one person who's nominated per resident can visit following kind of testing and PPE measures. We're going to be working carefully with care homes to sort of help them to support them in managing that process. And that's another issue we'll be watching carefully as we move into the next few weeks and months. Staffing levels remain really healthy and good, with only 4% of staff being absent, both across care home settings and in extra care and domiciliary care. But one thing that we are concerned about, and it's not just an issue for Darlington, it's national and regional, is that occupancy and void levels within particularly the older person care homes is being really challenging for providers. And we are supporting providers on a case-by-case basis where they approach us and explain, you know, and say that they're having these issues and that it's becoming unsustainable, or it's at a risk of becoming unsustainable moving forward, because that's one thing that we are monitoring and making sure that as a local authority we support providers to maintain their sustainability while we look at what the market will shape and look like once COVID has settled down and we've turned to a more normal picture in the provider market. And the other thing to note is that we've been allocating the Workforce Capacity Fund. This was announced by government on the 16th of January, and the guidance was received on the 29th of January, so it was a very quick turnaround. The funding is really for support with recruitment, retention and recognition of care sector staff and social care staff. And the money has to all be spent by the 31st of March. So it is a very quick turnaround with this. There's very rigid and robust guidelines about how that money is to be spent. But we have been working, and we've done some consultation with the provider market around this. And we are going to be distributing 182. We were allocated 250,000 from a Darlington perspective, and 182,000 of that will be directly given to providers to then utilise to support their workforce issues. But we were also going to be giving 53,000 of that money to support our Darlington Care Collective. And I was going to suggest, Chair, that I invite my colleague Martin Webster, who's been working with me on this initiative, to give a presentation on the Darlington Care Collective at a future meeting. It's a really innovative piece of work and something that we're developing. And it started out as our worries about the staff in the care sector being very adversely affected by COVID and having to support providers in maintaining their staffing levels. It's actually changed because the providers have got very robust business continuity plans, and that wasn't necessarily causing great concern. But what we're doing with the Care Collective now is developing and training our own residents to enter the care sector market as staff. And that's going to address things like future youth and employment issues and generic employment issues across Darlington. But it's a really innovative piece of work. I won't steal Martin's thunder, but we want to use some of that money to develop the training packages and provide training to those people referred into that project over the coming months. And a small proportion of that 14,000 was also provided to support our adult care colleagues and REACT teams to really help with the hospital discharge flow, so any overtime costs and weekend working costs for those staff. So a small amount of money was used to support that workforce initiative. And they were the key sort of reportings from myself. I don't know if anybody has questions before we bring Hayley in, because Hayley's come to give a sort of on the ground front line, experience of how it's been from a provider perspective to today's discussion.
Councillor Scott, would you like to ask your question?
Yes, thank you, Chair, and thanks very much, Christine. Firstly, been really interested to hear about the Darlington Care Collective. It sounds like something that we absolutely need. So I'll be really interested to see how that develops. My question is on the provider market. You talked about the provider market and how, as we come out of the pandemic, you have to see how it settles down. But in terms of risk, and this might be a difficult question to answer, but in terms of any potential risk, do you see any risk within the provider market generally in terms of viability as we go forward? And I'm thinking along the lines of where, providers aren't getting new people into their service because everything's sort of slowed down because of the pandemic, which has put financial pressures on them. So I'm asking about risk really as we go forward.
I think it's fair to say that within the older persons care market, and I'm sure Hayley will agree with me, is that they have had the biggest challenge over this pandemic. They've been hardest hit by coronavirus. And usually there is always a fluctuation. People will be referred into the service and come and live in that care home, and some people will leave for various reasons. The amount of people who have unfortunately died as part of this pandemic has seen unforeseen and unknown numbers of voids and occupancy drops, which we've never experienced before. And compounded with that, there was the generic feeling in the population that they really didn't want their loved ones to go into a care home setting throughout that period. There was a lot of fear. So it's not the normal state of things. And what we want to do is provide support so that care homes continue in a steady state until we get more to a normal picture, and then see how people's views and what family members' views are and how the market changes. I'm sure it will get back to a more normal level, but we're having to keep a careful eye on that in terms of future sustainability. What we are doing is we're putting in place a case by case, as I say. We will look with providers at their finances. What we won't be doing is supporting them with profit. We won't be supporting them with overhead costs. We'll strip that out, but we will ensure that they maintain the stability that they need to continue safely into the future.
Thank you. Thanks very much.
Councillor Holroyd.
Thank you very much. I have two brief questions. Firstly, you mentioned the improving rates of infection. That's great to hear. Do we know how this compares with national figures? Are we broadly in line?
I think we do, and we've all seen the news. It's kind of reported all the time. I don't have the figures to hand, but it is a national picture where the infection rates are dropping. The vaccines are starting to have the required impact. We all have to maintain our vigilance, but because we're seeing that in the general population, inevitably we're going to see improvements in care settings, and particularly in older persons care settings where that vigilance has been hyper vigilant throughout the pandemic. So yeah.
Thank you. And the second one was there's been a recent national decision to prioritise vaccination for those with learning disabilities. And how's this being implemented in Darlington? How do we reach all the people required? Can they be vaccinated at home, for example, if needed, if they can't attend a vaccination centre?
I'm going to bring my colleague Kevin in at this point. I know that we've been working very closely with primary care network staff members around that. And certainly I'll bring Kevin in at that point.
Yes, I mean, I can confirm that since the government guidance came out last week, our Life Stages team and Learning Disabilities team have been working closely with their health colleagues to identify all those who are eligible. So I think it's through GP registration. So we need to identify whatever everybody who should be on the list is on the list, and if not, make sure that they're on the list, and then ensure that everybody who is eligible is then vaccinated over the next period. So we're pulling the plans together as we speak, and we've been doing that since we first became aware in the middle of last week that was the case.
And it must also be said as well that also holds true for unpaid carers, because obviously they're in the next cohort, and we're working, as Kevin is, with our colleagues in GP practices in the primary care network to ensure that all eligible carers that are unpaid carers are also identified and supported to access their vaccinations as well.
Thank you. I've got one question. I'm not sure you can answer it. With this being a very difficult time for care homes, do the providers of the care homes or a council offer any counselling or support for the staff that have gone through a really horrific time having to deal with the influx of COVID cases within the care homes and then the subsequent deaths of the residents? Is there ample support for the staff?
That's an opportune time probably to bring Hayley in, because I know that CHUV, our colleagues in the Mental Health Trust, have been offering psychological support for staff and residents, but Hayley will have the best picture of what's available for her staff group. Is that okay, Hayley? Is it all right, Chair, to bring Hayley in at this point if there are no more questions?
Lovely, looking forward to it.
Okay, hi Hayley.
Hi, good morning everybody. I'm Hayley Roberts-Shaw. I'm a Director of Care and Development for St Martin's Care. We have 6 care homes across the North East, so I'm probably in a good position to have some comparison against your neighbouring authorities on how different authorities have responded, if that is of any help. In answer to your question, Councillor Curry, just the Darlington particularly have been incredibly proactive in terms of the psychological support that they are providing. Really from very early on last year, we were contacted by CHUV and there's a local psychologist, and I can't remember her name, who's been very proactive with my on-site management team, regular telephone calls, a lot of posters promoting some telephone support for our staff, and they're actually coming in to kit out the staff room. We did create a kind of wobble room, a bit of a breakout space for our staff, but they're coming in to put some bean bags and aromatherapy stuff and everything. So Darlington have been really proactive. I agree with you. I think some of our staff are experiencing some type of post-traumatic stress with what they've been through. where we're also investing in a wellbeing platform as well to provide some support for the whole of our workforce, not just Darlington. But yeah, it's very much at the forefront of our mind as an employer, how we look after the well-being of our staff after such a traumatic time. I guess from my point of view, what do you want to know? Because I could probably talk for the rest of my life about what we've been through over the last year. So I want to keep it relevant for you. I know time's tight, so it's probably best for you to ask me what it is you would like to know.
Councillor Layton, do you have any questions?
Thank you, Chair. Just really to pick up on what Hayley was telling us there and to link it to something Christine was talking about earlier, is this something that beyond the actual pandemic itself that we could sort of work on, you know, to sort of support staff and to encourage people, whether they're newly trained and going into the social care setting, or whether it's existing staff, to try and sort of bolster confidence and to sort of maintain morale? Because I imagine it is something, having worked in the care sector since a 14-year-old girl, I know exactly how morale is one of the fundamental driving forces for sort of having good times and bad times in the working environment. And I just thought that if we've got a good experience from this particular sad situation, it might be worth, you know, sort of bringing it into practice, you know, sort of further down the line and seeing if it's something that we can't do. Because I mean, I don't know how cost effective it is, but it is something that we could sort of help to support care home settings and even out in people's homes. Just a thought.
I think that's right, Councillor Layton. I think that part of the Workforce Capacity Fund was just for that, was about retaining staff and recognising what they've been through, and certainly well-being was something that we were promoting when we talked to providers and what they were asking for in terms of what that funding would be used for.
Do you want to ask me any questions? Is there anything specifically, or do you want to give me a bit of an overview of how Darlington have compared to other local authorities in terms of response? Would that help? I'll do that first.
I think that would be good, Hayley.
So I was kind of in a fortunate position, I guess, because I have very similar to Councillor Layton, I don't really know any other sector to work in, to be fair. So I have really good relationships across the whole of the north of England with commissioners and contract teams, but had never worked in Darlington with the local authority. I joined Willow Green in January last year as a consultant to support the turnaround work, and then joined St Martin's Care from the 1st of April. I'm sure there's some joke in that, joining an organisation in a permanent role at the start of a global pandemic on April Fool's Day. But it seemed to be a natural transition. So during the turnaround time, we'd built fantastic relationships, repaired broken relationships, and then forged new relationships with the commissioning team at Darlington. So kind of felt that we were in a really strong position as we went into lockdown and then subsequently what happened over the last year. We work really closely. I'm very collaborative in my approach. I share everything. I think as a sector, we have a duty of care, not just to our own residents and staff, but to the sector. So if there was any new risk assessment or any new policy that we developed, we would share that with the contracts team if it would have had any value for any of the other providers. I think we spent I spent probably the first 9 months angry and frustrated and felt that we had to fight a lot, not so much locally, but nationally. We did feel nationally that we were abandoned, I think is a pretty strong word, but reflects how we all felt as care home providers at that time. We at Darlington were great with telephone support, but we did struggle at times to locate masks when they became in short supply. And I did find the Darlington Public Health team not particularly proactive. And then we did go to was it called the Resilience? What was the forum called where you could get that additional PPE? We tried
LRF.
that. Yeah, we tried that once, but to be honest, it felt like the process to access it, we nearly had to give a sample of DNA, so we didn't bother. We actually used our resources across the group, so that was frustrating. But the Darlington, Chris's team were incredibly proactive, just in terms of that emotional support, because everybody was frightened. We didn't know if what we were doing was right. We didn't know whether COVID was in the building, not in the building. So it was a pretty scary time for everybody. But as I say, Darlington were proactive. I think Middlesbrough were the most proactive with physical support. So Middlesbrough Local Authority actually went on the road and were delivering surplus supplies of PPE to homes, and we have a care home in Middlesbrough. The others were pretty invisible, I would say. But I'd say Darlington and Middlesbrough were the most proactive. Darlington for emotional support and Middlesbrough for that practical support. We were really lucky for a long period of time in Darlington, and we kept COVID out of Willow Green until the end of September. So the second wave hit us really hard at Willow Green. We'd had outbreaks in our other homes, so we'd learned a lot. I think we had to learn pretty quick. So we did respond really well, but sadly we had losses like everybody else, and it's traumatic. You're losing 3 residents in a day, and nobody knows how COVID was brought in. You know, we had district nurses and community matrons and paramedics attending our home who weren't being tested. That was a continued frustration of mine, and constantly on a Twitter rant or contacting the national bodies for support with that. So I did. I don't know how it got in. We'll never know how it got in, but it did. But our team, the morale thing, I think, for Willow Green, actually responding so well to COVID, they felt incredibly proud. So although it was desperately sad that we lost residents in such traumatic circumstances, I think it gelled us as a team much quicker had we not been through that situation. Coming through the second wave, we decided, because our occupancy, we didn't have a great starting position, because in January last year we'd had an embargo because of quality issues at the home from the year previous. So we weren't in a great position to start with, but actually we're in a really good position, because we decided to set up a designated setting at Willow Green and at our home in Stockton. So that means that we are the place where people who go into hospital to be discharged with COVID come to our home first for their isolation period, before either returning to their original care home, to their own home in the community, or they transition into our home if we have vacancies. And that has been the most positive experience for the staff team, the sense of that they're part of the solution, that they're working closely with their NHS colleagues, of which we're always the poor relation. We never feel that we're seen as an equal to our NHS colleagues. That, for the staff, I think, has been the best decision we made. It was a difficult decision, and we had to consult with our families and our residents, because we've worked so hard to keep COVID out, and then we're opening the doors and inviting it in. You know, so we had to do a lot of reassurance, and we had to satisfy CQC regulations, of which we did, work closely with the local authority again, and that I'm incredibly proud of what we've achieved with that setting, because we had one person who passed away, but he was an unsafe discharge. He should never have been discharged to the unit. Everybody else has been supported to either move into Willow Green or to return home, which is incredibly positive experience. The outcomes are fantastic. So the designated setting is doing its job, keeping everybody else safe, but giving them really good care with good outcomes. So Darlington as well, out of all 6 local authorities we work with, are the only local authority who are providing us with some financial support. Every other local authority we approached either ignored us or said no. So that you are to be commended for that, because it's a really challenging time for our sector, not just for us as an organisation, but for the sector as a whole. We're now not just competing on quality, we're competing on the fact that every care home provider has suffered significant losses. So we have to up our game. But thank you very much to Darlington for providing us with that support. It may have taken some time from the approval to it being awarded, but the fact that we were listened to. Chris responded immediately. We had a FaceTime call with Chris and our CEO and myself to talk that through. We were listened to. We felt valued. We felt that we were needed in Darlington. And I had a really honest conversation. You know, some local authorities are saturated with care homes. And in some ways, I think this situation will solve some of their challenges with the market. But Darlington were very clear that Willow Green had a place in its future plans. We are a nurse and provider as well as residential, which I know is an advantage. But yeah, I think even if the outcome had been no, Willow Green doesn't have a future because we have so many residential homes, just the fact that we were given that respect and listened to meant a huge amount, and we're very grateful for that. So that's kind of my whistle-stop tour of the last year on what it's kind of, hope it gives you a flavour of what it's been like and how Darlington have supported us as a provider. Is there anything else people would like to know?
Thank you, Hayley. That was a lovely whistle-stop. Councillor Scott, you've got some questions.
Yes, thanks, Chair, and thanks very much for that, Hayley. That's really encouraging what you said. Just some quick questions, I think. Firstly, the PPE situation, is it okay now? Are there any problems still? Secondly, family visits. I know some care homes are providing sort of screens and different arrangements so that residents can have some contact. Have you had any experience of that, and how's it going? And thirdly, about the transfers of care, and it's really interesting what you said about the transfers of care and how your organisation has really embraced that. But we know that there's huge amounts of money put behind improving transfers of care from hospital into care homes before the pandemic. In terms of the administration, have there been any issues with that, or is it a smooth process?
Okay,
so
PPE, we have no issues with PPE now. We still get our government allocation. So yeah, we're fine. It was more in the first wave. Actually, the second wave was fine, but from April really till the summer was a challenge. And more masks than anything else actually was the biggest challenge. So that's fine. Visits, we actually, I took the decision that we didn't come into care to keep families apart, but we have to balance that risk. So last November, we actually introduced enhanced care visits across our group. And this is for residents who we could attribute their decline either in their physical health, mental health, emotional well-being to not seeing their families, even if they can't articulate that themselves. So we did an enhanced visitor strategy and a care plan and a risk assessment. So a number of our residents in Darlington and in our other homes have been having family members come into the home to visit them since November. We have it's not for everybody because we have to manage the footfall in the home, but we use them. We treat them as a pseudo staff group. So they have a weekly PCR test, which is more reliable than the LFD. The LFD is only about 48% accuracy at identifying a positive result, and sometimes I think would be better tossing a coin at the door. But we use the PCR. So they have a weekly PCR, then we LFD test them as they come in the building, and then they get to spend an hour and a half with their loved one, and they can come in every day for that. Has to be the same person, but that's been really welcomed. We have a visiting pod in all of our homes. We've had to give up a bedroom for that with the screen. I'm really not a fan. I don't think it brings any value, but we developed a whole suite of visiting options for people, and actually it has more value for the people on the other side who are shielding or themselves vulnerable. A lot of our visitors or residents' families are elderly themselves. So it provides them with that assurance as well. And also the value of having the screen, they don't have to wear a mask. So for some residents, that's much better. Although I have to say our residents' resilience is unbelievable, and how quickly they've adapted. Even residents who have some significant cognitive challenges have adapted to the mask wearing really, really well. And then we had garden visits, window visits, FaceTime, telephone calls. So yeah, the only challenge we've got, we sent the family communication out to say we're opening the doors We'd actually made the decision 3 days before Boris's announcement that we were opening the doors because it was a year since people had been able to come in their homes. Is that a number of our residents across the group have now received shielding letters to say that they have to shield as part of, and I don't know if it's part of the new 1.7 million cohort, but not a single resident, and we have, at the time we had 380 residents, did not receive a shielding letter through wave 1 or wave 2 of the pandemic, which is when they were at their most vulnerable. 97% of our residents have had their first vaccine. And now we're being told by Public Health England, we can't open the doors to the residents who are now shielded until the 31st of March. It's an absolute joke. So I've been on a Twitter rant and I've gone, because I'm not keeping them out, I'm not restricting that access anymore. I could have understood it in March. I maybe could have understood it in September, but now I'm hoping it's just been an error that it's been sent. So the Care Provider Alliance are speaking to NHS England to understand why that's happened. So yeah, Boris saying you can open the doors from the 8th, and then 4 days later, a high percentage of residents get a letter to say they have to shield. It's crazy. So I hope that answers your questions.
Thank you.
Thank you, Hayley. Councillor Holroyd.
Thank you. You mentioned testing as far as people visiting the homes recently. Has testing of whole homes been happening as far as outbreak control and that sort of thing? You mentioned that the frequency of routine testing was once a week for all the staff. I don't know if that's the same across other care home providers in Darlington. Good. And you said all the staff and well, almost all the staff and care home residents are now vaccinated. What will happen to the remaining staff? And obviously residents, you can't make them take it, but staff, will they be allowed to continue in employment if they refuse to be vaccinated, for example?
Okay, Chris is smiling because I do get on my high horse sometimes about everything that happens. But the testing, it's for staff, it's actually 3 times a week. So they have a weekly PCR test, and that's really reliable. It's a solid result. And then they are testing before each shift change. So if they do 3 days on, they'll do a test on the morning of their first day, and they have the testing kits at home, and they're the rapid test and the 30-minute result. They're only really reliable in the first 3 days of infection. That's when they have a high rate of being able to identify a positive result. But I guess it's a bit of belt and braces, isn't it? So the staff are being tested 3 times a week. Residents monthly. If they have had COVID, they don't get tested for 90 days. They don't get retested for 90 days. So the administration of that is a huge burden for our on-site teams. But I think they're in a good rhythm of it now. So that's testing. Sorry, your next. And what was the next question? Sorry.
It was about vaccination
yeah.
and the staff and
yeah.
particularly.
So we've started a no jab, no job, which is probably not a really good tagline to have on your advertising. But so for any new people, they have to have been vaccinated, or they have to be vaccinated within 14 days of the job offer, or we're removing their offer of employment. For existing staff, we've actually sought legal advice because obviously there are categories where the vaccination isn't relevant. So if they're pregnant, they're advised not to on the grounds of faith or religion, and also if they have underlying health conditions where their immune system is suppressed. So we have a small percentage of people who the vaccination won't be suitable for. For everybody else, we're going through a process of understanding their anxieties about the vaccination. We're having regular group discussions and one-to-ones. We have to be able to demonstrate that we've supported our workforce to understand why the vaccination is important. And as long as they're not in a group of protected characteristics, then we are I'm hoping they'll all get it. But if they don't, we will take them through a disciplinary process and dismiss, because the risk is far greater than their reasons for not wanting the vaccination. So, but it's not a quick fix. We have to be able to demonstrate And I really don't want to be the first test case in tribunal. So we have to be able to demonstrate that we've looked at alternative areas. So could they work in a less front-facing environment? Could they work in the kitchen? And that may be something. We're paying them for their time to go and attend, to have their vaccination. And I actually think the biggest thing that will swing it for the people who won't have it will be a vaccination passport. That will be the thing that they'll go, oh, well, if I kind of go to Benidorm, then I'll have to have my vaccination, which makes me really sad, because I think if that's the person, then maybe they're not right for working in care, particularly because every single home we have has had a significant outbreak, and I can't stress how traumatic that is. I don't think the words exist really of how traumatic it is when you're in an outbreak situation. So yeah, that's what we aim to be doing, but I'm hopeful we'll be able to win hearts and minds before we get to that place.
Thank you. That's really interesting. I have to say, I didn't know there were any faith exemptions for the vaccination. I thought they were doing a lot of work with all faiths to say, there's nothing in it that should cause a problem.
I think it's more if somebody expresses their wish to not have the vaccine based on the grounds of their religion, we can't put them in a position where they have to have it, regardless whether there's any evidence. But it's because it's a protected characteristic.
I see. Thank you.
Thank you, Councillor Holroyd and Anne Haley. We've got a question from Councillor Layton.
Thank you, Chair, and thank you, Haley, for all the work that you've done. And my heart goes out to you and all the staff in care homes, because I imagine it's been a traumatic time. I just wondered if you are able to get support, if, it might not even pertain to your particular group of homes, but if you're able to get support where, say faith is an issue, and you're sort of able to access sort of support either through the councils or through sort of faith groups to sort of speak to people. I just wondered whether you've been able to get that kind of support in the work you're doing to change hearts and minds of staff that are either sort of expressing concerns or refusing to have the vaccine. Just wondered if that was something you'd experienced.
Currently we're just collating our data, and because like every week I get vaccination data on a Friday from our managers to see where we're at, and it is steadily increasing. Currently I only have one member of staff who's declining on the basis of their religion, so it's probably I want to do a bit more hearts and minds before I go and talk to faith leaders in the community to see if there's any additional information that we can provide. If I'm in that position, that's what I'll do. If we get to that point, I will speak to local faith leaders to see if they will come in and talk about the importance of the vaccination. But I'm not at that stage just yet.
Thank you very much. Any more questions at all? Okay, thank you very much, Haley. That was very, very interesting. Next item will be the work programme. Councillor Scott, would you like to give us a feedback from the autism working task and finish group, please?
Yes, Chair, certainly. Actually, the task and finish group was just held last week, and the minutes of the meeting are just circulating now. So apologies to members that we haven't been able to get the minutes out in time for this meeting. But just to give you some background, members will recall that the Darlington Council wanted to become an autism-friendly town, and going back about 4 years now, we did lots and lots of work, predominantly with the private sector, to try and make people with autism, their experience of life in Darlington, to improve their experience of life in Darlington. So, for example, we did lots of work with the town centre retailers to make those visits to retailers better for people with autism. We did lots of work with hotels. The work was predominantly around the private sector, and it didn't essentially involve sort of commission services within the council, and we're very clear about that. But in the last year, we've been talking about, well, what more can we do? And we wanted to sort of put the group on a more formal footing, so we could pursue some of the issues that we've discovered. At the meeting last week, we talked about certain issues that we think are very important. So there's things like ongoing training for our staff and for any other staff, and how you access that training and who provides it indeed. We talked about data gaps, particularly involving adults with autism. It was recognised that there are a lot of data gaps involving adults. There is an autism steering group, which is an officer-led steering group, and we felt that possibly there's that the work of that group should be more widely shared with members. Specifically, we talked about assessments and diagnosis of autism, particularly amongst young people. We all know anecdotally there are a huge amount of complaints about the length of time it takes to get an assessment and diagnosis, and we'd like to look at that further. And finally, around employment and how can we as members sort of try and influence outside bodies and the council to improve employment opportunities for people with autism. It makes a massive difference for someone with autism to get employment, and there is significant employment gaps within that group. So we've recommended a more formal cross-party autism review group, and that recommendation would come to this committee and also the Children's Scrutiny Committee and the Health and Housing Scrutiny Committee. So the three committees sort of own that group, similar to the climate change group. So the three committees own that group. If approved by the three committees, it will then go forward to cabinet for them to sort of approve the group. So it becomes a formal group. So I'm not sure where we would stand today in how we would progress that. I'm going to take what members' views are and what any comments. On that group last week, obviously Councillor Curry was there and Councillor Layton was there. So has anyone got any questions or comments on that?
It doesn't look like it. Oh, Councillor Cully has something to say.
Sorry, Chair, I couldn't find my button in time. That committee, somehow I completely missed that off my schedule. I would have come to that if I'd realised. But I think what you're suggesting, that it goes across adults, children and health, is a great idea, and that we should take that forward would be my view, because it affects more families, I think, than we think. So yes, I think it's a great idea. Thank you. Don't know how I missed it.
Any more questions? Do we all in? Oh, Councillor Holroyd.
I just wanted to add that I'm in the same situation. I wasn't aware of that meeting taking place. So yeah, it's very interesting.
If I remember rightly, Councillor Mills spoke at one of our past meetings and said she was forming this group and asked for people who were interested at that point.
Do you want me to jump in, Chair? Yeah, okay, sorry. Yes, absolutely. And I think because everything had gone on hold because of COVID as well, I think possibly people were caught out. But at the time, I think people volunteered from the scrutiny committees to be part of that task and finish. And forgive me, because it was so long ago and I have slept since. I can't remember exactly who who had volunteered to be on that task and finish. But just to say, from my perspective, and I know obviously everybody who was there at that meeting last week knows, I'm fully supportive of this, and yeah, absolutely. Hopefully we take this forward and do some good work.
Can I ask, is there anybody on this meeting who objects to this being transformed from a task and finish to a working group? Anybody object? Okay, I think unless we get a formal paper, we are all in agreement for that to go forward. Councillor Scott.
That's brilliant, Chair. Thank you very much, and thanks, members. I think the paper is actually emailed out now within the last 5 minutes, actually. So it's with us all now. So if we can sort of retrospectively agree that recommendation that we take it forward, then that's our scrutiny committee ticked off, if you like, and there's the other two to go. So thank you for your support.
Yeah, if anybody has any questions once they've read the paper, please direct them to Councillor Scott, and I'm sure he'll be able to answer them. But I'll take it that we are formally, in theory, agreeing to the movement forward to a working group. Okay, anything on the work programme? I think April is going to be quite a busy meeting. Is there anything else? Is there anything missing? Is there anything else you'd like to be added? Councillor Holroyd. You're on mute, Councillor Holroyd.
Apologies. I'm just aware that the Children and Young People Scrutiny Committee had quite a big review about how coronavirus and all the pandemic response affected children and their families. And I can't help thinking that it's very relevant for people who are in care homes and also older people who've had to shield at home, and that impact could have been very similar, and whether we should try to do something similar as far as adults, particularly the mental health impacts. I think they had a kind of hearing day where they asked people to come in and speak and make any recommendations as far as, I mean, we don't know if there were going to be further lockdowns. Obviously, fingers crossed there won't be, but whether there should be any changes that people would suggest as a result of their experiences so far, for example.
Councillor Mills.
Chair, if I can suggest, with that in mind, Councillor Holroyd's suggestion, and obviously I'm treading carefully here, but with it being mental health is going to be a big part of that, my suggestion would be that you possibly approach health and wellbeing scrutiny and either push it through there, or it becomes a joint piece of work, possibly on the work programme, but you'd probably have to put in a joint quad of aims to do so.
Are you happy to take that forward, Councillor Holroyd, or would you like somebody else on the committee to work with it?
It's certainly an area of interest. I don't know if I would have the capacity to take it forward alone. If anybody else would like to help, then I'd certainly appreciate it.
Councillor Layton?
Could I volunteer to help with Councillor Holroyd, because I sit on the Health and Housing Scrutiny Committee as well. So perhaps with a bit of sort of input, just if any, from anybody that wants to chip in, would be more than happy to work across both scrutiny committees, if that's agreeable with everybody.
That's excellent, Councillor Layton. That's covering both committees. Please let them know that you're doing that, though. Okay, thank you. Anything else on the work programme? All right, we'll go on to item 6, which is supplementary items. Are there any supplementary items of a nature that can be discussed at this meeting? Nope. Item 7, any questions? No questions. Okay, the meeting then can be closed. It's come to an end. I look forward to seeing you all in the next meeting, and looking forward to the April meeting. It looks quite a busy one. Thank you very much, everybody.